hope so.
Okay, so we are at 18. I think we'll get started as more people come in. We don't, first of all, welcome back to regular classes after the spring break. Hope everyone had a good time. So we don't have any announcements, but we did post the grades for the midterms. We were able to get the grading done. And if you guys have any problem or anything, just let us know. As usual, we are available through email anytime. So feel free to communicate, please. And so let's get started with today's speaker. Today we have Dr. Rock with us. So we're going to hear a lot about Ayurvedic medication and the field itself from the expert. So let's get started. So Dr. Katharina Rock is an Ayurvedic doctor. She's practicing out of her Oakland office, serving clients in the wider Bay Area. She got her first taste of Ayurveda in India in 2006 and got fascinated by the personalized and holistic approach of this ancient medical system. She started studying at the California College of Ayurveda in Nevada City in part-time and later full-time. In 2016, she decided to leave the corporate world after 20 years and focus full-time on the practice and teaching of Ayurveda. Her special focus is in herbal therapies. So let's welcome Dr. Katharina Rock and get some information about it. Thank you so much, Dr. Rock, for coming in today. Over to you.
Thank you so much for having me. It's really a pleasure. I love talking Ayurveda, as you will probably see. Just a quick technical question. We have until 7:30.
Actually, like 8 o'clock.
8 o'clock. Okay.
Yes. Yeah, like 7:50, but we'll have just leaving some time for questions if somebody has some. But technically, yes, 8. But it depends on you how you want to go. Have a break in middle for questions or just leave the time at the end. Depends on you.
I don't see the chat right now, so I'm not quite sure whether we have one or people have just to raise her hand and somebody has to monitor it or something. Great. I love to be.
Yeah, we can do it for you. If you like that, we can if you stop in the middle, we can, if there are questions in the chat, we can say them out and you can answer them if that's good with you.
Okay, perfect. Yeah, I don't mind being interrupted for questions. I'd rather have that than people checking out or something. So, right, and anytime questions are fine. All right. So welcome to Ayurveda. This is an introduction. Ayurveda is the traditional medicine system from India. That's actually in Rajasthan. That's the Palace of the Winds, the little picture that you might recognize. So Ayu means life and Veda means knowledge. So it is the knowledge or the science of life. And that seems a little bit like a big term, but you will see that we look at it really from a very holistic perspective. We look really at what people eat, how they exercise, what kind of weather influences they have. So all of that, the food, of course, all of that is taken into consideration. So basically, we really look at the whole life of people when we look at Ayurveda, because everything can influence your balance and your health. Right. The other thing you're going to see, it's a personalized medicine approach. It sounds modern, but it's actually very old in the sense that we really take every single patient as an individual. Everybody is unique. Think of your genetics, right? Everybody is unique. Certain people digest well peppers, certain people don't, right? Some people digest well dairy, some people don't. So we really want to make sure that we check on everybody individually. And so that's, if you want, it's personalized modern medicine. A technical thing is that Ayurveda right now is not a licensed medical profession in the US, so nationwide. However, in California and in several other states, it's governed by state laws covering alternative healthcare practitioners. So in California, for example, it's a valid practice, but there is no law and no license agreements basically on a US level. Ayurveda is pretty old. Nobody really knows how old. There is a little bit of a competition between the Chinese medical practitioners and the Ayurvedic practitioners, who is older. But it's really hard to say because by the end of the day, same as the Chinese medicine, it is based on oral tradition, right? So in the old times, all this knowledge was transferred from the teacher to the student. And then the first record that we have is actually from 1500 before Christ, the Artava Veda, where we see a collection of herbal medicines or herbal formulas. That's the first written record that we have, but it is thought that it actually goes back 5,000 years, which is about, plus minus the same age as Chinese medicine. Then there is a Ayurvedic treatise, the Charaka Samhita. It's an 8-volume collection. It's a big series of books that goes very much in depth about Ayurvedic treatment and herbs. The Sushruta Samhita I wanted to mention here because it's the first time that actually surgical procedures have been documented and how to do them, all the instruments needed. It's quite something. They did eye surgery, they did all appendices, so it's really amazing what they did in these early times. Then about 1000 after Christ, Ayurveda begins to decline when the Muslim rulers basically started invading India. However, they brought their own medical system, and that was actually the start of the Unani medicine, which basically combines the Ayurvedic as well, the Arabic medicine. So that's very interesting as well. And then around 1300 to 1400, we have the Saragandhara Samhita, which is, I always have troubles pronouncing, with more formulations and preparations in herbs and so on. Okay, this one here is as well interesting because pulse taking, which is now at the core of Ayurvedic diagnostic, has been recorded the first time, right? So it wasn't originally in the classical texts. It only got there, or it was first recorded around 1400. So everything we do in Ayurveda is centered around these doshas. Call it life forces or energies. So you will hear that again and again. Whenever you see something Ayurvedic, you probably hear about the doshas. We have Vata, Pitta, and Kapha. Vata is the air energy or humor. And the main quality is its movement. So figure something, anything that moves in your body, your circulation, your thoughts, the food that goes down the pipes in your stomach and out on the other end. So anything that moves in your body has this Vata energy to it that makes it actually move, right? Anything in the Charaka Samhita, basically anything that has a form will have qualities. So the Vata energy, imagine it like a dry wind. It's mobile, it's light, but it's dry, right? Dry and cold. And we get more and more in these qualities later on as well. Just note that we always talk about qualities, both for diagnostic as well as for treatments. Then we have the Pitta dosha, which is the fire energy. And fire, basically the main task of it is transformation, right? Anything that your food gets transformed when it's digested, so your body can basically absorb the nutritions. When you read a book, you basically absorb that information, but then there is a digestive process in your brain that basically say, now I got it, the understanding, the perception, that is driven by Pitta. So anything that's basically transformed, whether it's muscle energy, whether it's learning, whether it's the food that's digested, there is a Pitta component in there, right? That's the fire. And then we have Kapha, which is the earth energy or force. And that's bringing us the stability. It holds things together. So, right, we have earth and water, so imagine it as a muddy substance. But it's very important because it basically gives you the stability, it gives you the lubrication that we need in order to, so bones are very earthy, right? So that gives us the structure, the skeleton, the stability. The mucousy qualities help us keep our nostrils moist and our digestive system moist so the things can actually flow. So anywhere where you have anything in your joints, right, there is lubrication, there's a gel-like synovial fluids in there that basically allow the joints to move. So all of that lubrication and stability comes from the Kapha element. All right. So I'll make a few more examples how this translates. Then we probably might have some questions here. But as I said, interrupt anytime. So it's no problem. So what does it mean for me personally or for you? If you look at these three energies, Vata, Pitta, and Kapha, they are combined in all of us. We all have blood circulation, we all have a digestion, and we all have bones, right? So nobody is a pure 100% Vata, Pitta, or Kapha. We all are some sort of a combination of all three. What's different from each of us is the percentage or the components. So I might have a little bit more Pitta than Vata or Kapha, right? Because you can see I have a little bit of a reddish face, so that's my Pitta, right? That's the fire that comes out. Other people, they have these wonderful big hair that I always envious about, and that's a Kapha sign, right? So we all have all three doshas, but we have them in different combinations. A lot of times, 80% of the times, there is one that's predominant. We have a few occasions where two of them might be dominant and the third one is less, or we have the 5% of the population where they are tridoshic, as we call it, where Vata, Pitta, and Kapha are there in equal amounts. Right? But that's fairly rare. Most of us, I would say 80% of us, we have probably one that's more dominant than the other two. Right? But yes, we have these tridoshic people. They by nature, they're very balanced. Okay, Marie raised the hand.
I was wondering, is it ideal to have all three of them balanced, or I don't know.
Okay, so Marie went on mute. It really doesn't matter because whatever you are born with is a good thing, right? So there is no, it's not good or bad to have a red skin or a more reddish skin or something, right? It's not good or bad to have big hair or something. The important part, and we get there in a second in the next slide, is that we really live in harmony with whatever we got. Right? So, and we get there in the next slide. So you'll see that in a second if you give me one more slide, please. Right, so it's really, there's nothing good and bad. There's nothing bad or good about being a tree versus being a dog, right? I mean, it is just what it is. The trick is actually to learn in harmony with whatever your constitution is. Does that make sense, Marie?
Yes, thank you very much.
Absolutely. So, so we have our born with constitution, and we call that base constitution. So this is basically your genetics. That is what you're born with. But then we have today's balance, right? So if I eat, let's say I'm a 50% Pitta, 30% Vata, and 20% Kapha, right? That's just my genome. But let's say I'm eating popcorn and crackers the whole day long, very dry foods. I never basically, I might even eat spicy food, which is more drying. I will end up with a Vata imbalance, right? Because if my environment and everything I do is drying, super mobile, and basically aggravating Vata, then I get myself into a Vata imbalance, which means basically I have more Vata than my base constitution provides for me. Okay. And we get there in a second. So, but these daily influences, they change every single day, right? The seasons are different, the temperatures are different, the food might be slightly different. I might be under stress because I have to finish a project. So we are exposed to these influences. We are open systems. And that's what we need to manage. So there is no need to manage our base constitution, but what we do need to manage is the influences around us.
I have a question.
Sure.
So I was pretty curious. You said that these are our base the base constitution is determined by our genetics. I was wondering how would an Ayurvedic doctor determine that?
Oh my God. I will get there, Amanda. Okay. Very good questions. Okay. So, so we have these doshas and we have them in a particular combination, and we have the daily influences from the outside world, right? So that we need to manage. And we get there, well, how we do that. And what we do actually, and let me just go to the next slide and then I get you. So the way I explain it often is with a boat analogy. Let's assume I'm that little tanker or cruise ship or whatever it is in the middle, right? So you might be a kayak, somebody else is an oil tanker, the other one is a cruise ship. So the shape and the weight and the size of the boat might be different for all of us, right? But we have these Vata, Kapha, and Pitta tugboats, and they all pull us a little bit in a different direction, right? So my goal is to stay in the shipping channel, right? So I want to basically go in a particular direction, which is safe, and I know it's deep enough, and it's good for me, right? But then Vata, Pitta, and Kapha will each on their own, imagine it as little tugboats, they will pull me in one or the other direction. So let's say Pitta, for example, I eat a ton of spicy food. So the boat will be pulled by that Pitta tugboat in the Pitta direction, right? And if I don't watch it, then all of a sudden I end up with a Pitta imbalance, right? Let's assume I eat cheese pizza the whole day long. Cheese is heavy, moist, a little bit slimy. It's definitely very kapha provoking. So if I eat cheese pizza the whole day long, all of a sudden that kapha tugboat takes off and I might capsize, or I might be pulled out of the healthy shipping channel. Right? So that's and then obviously different things have different horsepowers if you want. So let's say I eat cheese pizza the whole day long. That's a lot of horsepower on that kapha tugboat, right? If I only eat a half cup of yogurt, that will not have a lot of horsepower, right? Then that will balance itself out the next day or something. Whereas if I eat for 6 months cheese pizza and McDonald's, then all of a sudden that kapha tugboat gets a lot of power and a lot of mileage. So, and then eventually I will probably tip over on the kapha side. Right? And I put a little clouds and sunshine here as well, because yes, we are influenced by seasons, by temperature, by stresses, by outside influences. Does that picture make sense? Sort of. So it's just, so the question is really how much horsepower do you give your tugboats, and can you keep the three in balance so you actually stay nicely in your shipping channel? Okay. So if you are happy and happily floating in your shipping channels, then a healthy balance shows an absence, obviously, of diseases or any discomfort, right? No pains, no headaches, no rashes, nothing. But as well, you will find that you have a good physical and mental energy. So you're just humming along, and you are happy, to do your studies and have enough energy for all of them. You have a good immunity, both stress resistance as well as physical immunity. And one of the signs that I find a little bit more subtle, but very obvious once you look for them, there is a certain joy, clarity, and contentment. So it's not euphoria or something, right? that you might have after, I don't know what, 3 tequilas or something, but it's really that content, being happy, being clear in your mind. That is a sign for good ojas, good healthy balance. Okay. And that's where we want to go to, right? So I don't want to basically make everybody a kayak or make everybody an oil tanker. We need to find a balance for your particular type of boat. And once you're in the balance, then you can happily tug along and basically have balance, clarity, physical and mental resilience, and so on. So far, so good. Okay. So let's assume you are a person where Vata is the strongest dosha and Pitta and Kapha are a little bit less. So these people usually look, so remember, Vata dosha is basically the main sign is movement. So we have a lot of movement of fluids, we have movement of food and so on. So the body type for Vata dominant individuals is they are longer, they are thinner, they have usually thinner bones, they usually have, or a lot of times they have curly hair, doesn't have to be, but can be. They have less muscle mass because that high movement simply doesn't allow for substance to build up a lot of times. Right? So it's just like they can be either very long or very short, doesn't matter. And a lot of times you see some irregularities, maybe fingers that are slightly tipped, or maybe one side of the face is a little bit different. And we all have that, but Vata people have it a little bit more. So there's anything a bit irregular. For example, irregular teeth, for example, for us, that would be a sign of Vata. Right? When they are in balance and they are happily in their shipping channel, then they are enthusiastic because of all that moving energy. They are very adaptable. They're good communicators. They're very creative people. They can connect easily because of that movement toward other people or subjects. They're fairly dynamic, so that is when they are happy. If they're out of balance, then all of a sudden you see anxiety, you see indecisive people, all the people in the restaurant, they can't make up their mind what they want to eat. So if you have people that change their minds 5 times what they want to eat in the restaurant, there is probably a Vata streak in there. Right? So the Pittas will say basically, I want the tuna salad and that's it. And they make up their mind within the first 5 seconds when they move in the restaurant. Right? So that's what you see when Vata gets a little bit out of balance. They get a bit indecisive, a bit hyperactive, restless, and so on. On the physical side, what you see most common in Vata imbalances is dryness. Right? That might be dryness in the joint, dryness in the digestion, which basically is gas or constipation. There might be dry skin, wrinkly skin, burned out tissues, insomnia, anxiety. All of that would be physical challenges, right? Because that is just that too much movement and too much dryness. Like that all leads to that. And what we're gonna do in order to treat that, basically, we bring in the opposite, right? We bring the opposite qualities in. We bring in heavy, moist, warm, and stable qualities. So the biggest challenge for Vatas is routine, doing the same thing every day, right? Whether it's a yoga practice, whether it's any sort of practice. So that's the biggest challenge. Right? But that is exactly what balances them and keeps their mind from constantly overheating and overrunning. Okay. So the Pitta people, there is no such a thing as a Pitta person, right? But these are the people that have more Pitta energy than the other 2 doshas. Remember, the Pitta dosha is the main principle is transformation. The Pitta is the fire element. So the qualities would be hot, light, slightly moist, and unstable, right? Because it's like a campfire, right? It just moves, the flame moves, and it's definitely hot and light. Referring to that fire element, what you see is basically high metabolism, right? So you see people that build nice tissues because they digest their food really well, and therefore they can build healthy tissues. You see angular faces, a lot of time a bit more rosy or reddish in complexion. Medium features, they're not super long, they're not super small, they're not super heavy, they're not super thin. So it's kind of in the middle ground, the Pitta people. When they are in balance and happily in their shipping channel, because of their high metabolism, both physically as mentally, they are very perceptive, they are clear, they are fairly intelligent. They love to learn, right? They just like to learn new things and absorb new things. They are good teachers, they're good leaders because of that light quality, that bright quality that they have. However, when they get out of balance, it's a little bit of a mess. Then all of a sudden you have aggressive people, they are super intense, they can be very controlling, impatient, jealous, all of these hot emotions that we see when people get a little bit out of balance. And over the years, I noticed that I can notice in myself if I get a little bit too much on the Pitta side, if my Pitta tugboat takes off on me, then I notice that first in my mind. So, before I see anything happening in my body or in my digestion, I see it in my mind. So let's say 3 people walk in my office, and every single time I have something to criticize, or whatever, they're stupid. The third time something happens like that, the third time a person walks in the office and I call or think they are stupid, that is a sign for me to say, ooh, Katharina, your pitta is getting out of control. Because statistically, the chances are I'm the problem and not them, right? So pittas just tend to be a little bit critical. They tend to be impatient. And obviously you can see that both in the mind as well as in the body. And the mind is much faster to react, right? So it's you can see that there. Physical challenges for pittas are quite often overheated metabolism. So anything that has to do with diarrhea, ulcers, reddish skin conditions, inflammation, migraines, because there's just too much pressure on the brain from the blood circulation. So anything that's basically related to some sort of a heat, inflammations, and so on. What do we do with pittas? We cool them down with anything we have. Lemon balm tea, cucumbers, heavy, cool qualities, whether it's for the nerves or whether it's for the body, that works best for them. A lot of times, my Ayurvedic practitioner that I worked with for years, she said basically in the Bay Areas, you will find a lot of pittas because pittas are attracted to the cooler climate that we have here. Right. So it's just the people just choose the temperature, or if they can, they choose the temperature they're most comfortable with. And the San Francisco climate obviously works well for people that are naturally a bit hotter. Okay. So while the routine was the key element or the key treatment for vatas, for pittas, it's the moderation. Tone it down, cool it down, tone it down. Don't overdo it, don't exercise 20 miles longer or something, just in moderation. And that's the biggest challenge for pittas, right? It's just, because they like to be extreme. They are extremists, if you want. Right? So cool it down is the key for pittas. And then we have the kapha people. And remember, kapha is the earthy, moist quality. It provides stability and protection, both mentally and physically. So naturally then the kapha type, the people with more kapha than the other 2 doshas, they are bigger, they are more stable, they have larger bones, they have a bit more of a stocky build. They have excellent musculature, like these people that really build musculature very well. Luxurious hair. So anybody who can build good and solid big tissues, there is a kapha component in there. When they are in balance, because of that loving and stable quality, they can be very calm, peaceful, they're compassionate, they love to care for their families and friends, the people that love to cook, for you or something, and they love good food. So these are all really the emotions or the symptoms, the signs of a balanced kapha people. But if there is too much solidity and too much kapha in there, then people get stuck. So all of a sudden you have people with a lot of attachments. They are attached to their memories. They're attached to their, overly attached to their professions or their cars, or, like they have a hard time cleaning out their closets because there is so much attachment there. They can be difficult to motivate. Because they simply don't want to move ahead, right? Because there is just too much, they're stuck somehow. Right? Physically, that shows in, for example, respiratory challenges, in the sense that there is too much mucus building up in their lungs. The lungs is a site of kapha. So then all of a sudden you have these mucousy conditions in the lungs, you have breathing difficulties, you have things like overweight and lethargy and diabetes. This all people are basically too slow, they need to move, right? So, and then for them, the challenge is really move, right? Get going. So, they tend to be a little bit couch potatoes. So the challenge really is, and the challenge and the treatment is actually to get them moving, right? Because with the movement and the circulation comes in, the heat comes in, the digestion comes in, and that will balance it out. Okay, let me just see what's next. So, any questions at this point? Nope, doesn't look like it. All right, let's move on. So the next 2 slides, and I promise I won't read it through, is a dosha quiz. So these are all the things as a practitioner and a few more that we look at, you know. So I might have curly hair but a red skin. So every single time you basically get a check mark on one of them, you added you get a little point, you get a vata point, or you get the pitta point, or you get the kapha point. Remember, we have all 3 doshas, so you will have checkpoints in each of the columns. And then on the very bottom, you basically add it up, right? And then you might see that you see whatever, 70% vata, 20% kapha, and 30% pitta, or something, some other combination, right? So these are just the physical or mental traits that we look at, but that gives you an idea. Okay, the screen came up, okay. There is 2 pages of it. I'm not going to go all through them. There is a bunch of dosha questionnaires or quizzes on the website, on different websites as well. I have in the appendix, you find some of them listed. Banyan Botanical has a dosha quiz. Joyful Belly has a dosha quiz. Here is mine. Just go through and see, you know, where you end up. So when you go through these quizzes, think of your long-term patterns, right? Not just what happened yesterday, but think of the last 10 years or something, right? Because you want to look for patterns. You don't want to look for, yesterday I had spicy food and therefore I have a red face. You know, like you really want to look at long-term patterns as much as you can. Okay, does it make sense? So go through, and then you will find that, you know, you might have check marks in one column more than the others. And that gives you an idea where your doshic balance is. So let's talk about imbalances. An imbalance is when you are not harmonious with your constitution, with your base constitution. So in Ayurveda, we always say it's an excess dosha, right? So in that chart on the left-hand side, what you'll see there is vata, pitta, and kapha, but then you have this yellow extra thing on the pitta column, right? So that would be an extra pitta that is more than what your base constitution provided for, right? So let's say I'm predominantly pitta 50%, I eat spicy food the whole day long for the last 3 months, I will end up with that little yellow extra pitta. And that is then the imbalance. So if I only had spicy food last night, it's, yeah, my tugboat went a little bit off on the pitta side, but usually then today I eat whatever, cucumber, something cooling, and then I will be fine again. The problem is if you have these imbalances for a long time, then what happens then is then these doshas not only happen in your digestive system, but then they can be lodged in all kinds of other tissues. Let's say you have a pitta vata imbalance for long term. Eventually you might end up with arthritis and inflammation in the joints, right? Because you have the dryness from the vata, you have the inflammation from the pitta, and that's a perfect combination for arthritis, right? So once you have these imbalances for a long time, then they can lodge in all kinds of tissues, and usually they go where you have a weak spot. You know, some people have a weak spot in their skin, some other have them in the bones or in the muscles. So eventually they get dislodged in those weaker area and then show up as diseases. Or this disease is basically a dis-ease. You are not at comfort, right? And that's where they show up. So don't worry if you just had spicy food only last night, that's not a cause for concern. But if you do something that brings you out of balance over the long term, then you better go and check, and basically, because then your ship goes out of the channel, maybe, you know, like in the Suez Canal, it ends up on the banks eventually. So that's something to watch for. And we always want to catch these kind of things as early as possible, right? Even things that, you know, we might not go to a doctor for, constipation for a few days, you know. That is not a big thing. I think nobody goes to a doctor for it. However, watch it and then treat it as quickly as you can, because that keeps your ship in the channel, right? So don't wait until it's 3 months over, and then all of a sudden you have all kinds of issues with it. Okay. Any dosha can be out of balance. You know, if I eat my cheese pizza for 6 months in a row, then all of a sudden I end up with a kapha imbalance. If I only eat popcorn and crackers and never any oils or any healthy fats, then I end up with a vata imbalance. So any of them could be could be out of balance. Statistically, people have a tendency to go first out of balance in their predominant dosha. So I'm a predominant pitta person. Then I have a tendency to go first out of balance in my pitta dosha. But it doesn't have to be, as I say. If I eat popcorn and crackers the whole day long, I end up with the vata imbalance regardless of what my predominant dosha is. Right? So a few examples for each of them. So vata imbalances, if they stay with you long enough and if you don't take care of them, would lead to emaciation, debility. Tremors is a weakness or basically a loss of tissue in your nervous system. Constipation I already mentioned, dizziness because of a lack of circulation, or too much circulation to sometimes, anxiety already mentioned. Those would be typical vata imbalances. And these are just examples, right? This is not just everything. Pitta imbalances could be excessive hunger or thirst due to that heightened or excessive metabolism. Pitta's, too much heat creates loose stool or diarrhea. And then I mentioned already inflammation and anger as heated emotions and inflammation just because there's too much heat in the tissues. Kapha imbalances is usually sluggishness in any shape and form, slow metabolism, lethargy, excessive sleeping. Daytime sleeping is really not recommended, particularly not for vata, for kaphas. Breathing obstructions, I already mentioned those. Right? So just keep in mind, disease is basically an axis of a particular doshas. In the Chinese medicine, you have axis as well as deficiency. In Ayurveda, we only look at axis. Like, so it's just a definition. It's just the way we see the world. The Chinese medicine is slightly different here. Any questions so far? Nope. All right. So and another very important part of the philosophy or the view of Ayurveda is Agni, which is the digestive fire. Right? So we talked about that pittas have a little bit a higher or stronger of these fires, but everybody has one. Everybody digests food. Everybody learns something eventually. But in Ayurveda, we consider digestion particularly important because that's where it's the foundation for healthy tissues, right? If you don't digest and absorb your food properly, then you will not be able to build healthy tissues, right? Your nutrition doesn't get to the right places. The cells can't take up the nutrition from the blood. So Agni, or the digestive fire, whether it's in the stomach or in every single cell, is super important for building healthy tissues and well-functioning tissues. As I mentioned earlier already, that yes, we have it on the cellular level as well. The biology students under you will, imagine it's a little mitochondria. Right? So it's really those little energy plants in the cells. That is basically what we think of Agni. That really help that the cell basically can do its work, can do all the functions that that particular cell needs to do. So then from an Ayurvedic perspective, we would call that Agni. So if the Agni is not strong enough, then all of a sudden you end up with toxins, or what we call ama in Ayurveda. And that's if you imagine a campfire that only gets wet wood and the fire is not strong enough, you have this soot stuff, right? We have this black, slimy, fatty stuff, and that will actually clog your system, right? So if it's like a badly burning fire with lots of smoke and lots of soot. And then eventually that soot will basically clog your channels, clog your cells, clog your membranes. And that is actually causing a lot of issues eventually on the long term. Again, if you do it just one night, it's fine. But if you do it on the long term, then that is causing all kinds of issues. One of the signs of AMA in the digestive system is actually the coating on your tongue, right? So if you look at your tongue in the morning, and you will notice that your coating changes pretty much every day, depending on what you ate before or ate the last day. You will notice that if you had a lot of cheese pizza, your coating will show a little bit more white and a little bit more thick. If you have a fever, your tongue is basically pretty much bright red and everything is burned off, so there is no coating. So you'll see that you see maybe some dryness on your tongue. So that's one of the indicators of AMA, is the coating on tongue. It's not the only one, but it's one that you can see very easily. Right? And if there is lots of it, then people feel, like just energyless, fatigued, various digestive issues because they can't digest properly. People with bad breath have a lower Agni, right? Because it's just that the fire doesn't burn hot enough to basically burn off that wet wood. And generalized body ache. So all of those would be examples for AMA in the system. Right? So that's quite important. If AMA is Agni, the digestive fire, is imbalanced, then depending on the type or on your, doshic balance or imbalance, you will see the following things. So the Vatas usually have an irregular metabolism. Sometimes they're hungry, sometimes they're not. They order more food that they want to eat, or irregular appetite, a very very typical thing. Abdominal bloating, pain, constipation, gas, alternating constipation and diarrhea, gurgling intestines, when your stomach talks to you, all of that would be signs of a Vata imbalance and a low or irregular digestive fire. For Pittas, it's the opposite. For Pittas, usually it's just too much of a fire. And yes, there is such a thing as too much. You have excessive strong appetite. You can eat half a cow, 3 times a day. You have heartburn, hyperacidity. As I mentioned earlier, diarrhea is an issue for Pittas. But then eventually you're gonna attack your own tissues, and then that leads to ulcers and gastritis and so on. Right? It's just like hypermetabolism. That would be too much of a fire, and that can be destructive because it actually eventually attacks your own tissues. Right? And then the kapha is basically the imbalanced Agni, or is too little of a fire, right? Happiness in the stomach, producing a lot of saliva, no appetite, get nauseic every time they eat something. That just means basically there's just the fire is too low, right? And in that case, you want to add some fire. You want to add spices, hot spicy food or something. That would be great for those people. Okay. So Agni, the digestive fire, is really at the core of Ayurvedic health, because it helps you to absorb your food properly, to digest your food properly without any residues that then can later on clog your system. And then you have the digestive fire, if you want to call it that way, in the mind. And that has to do with basically the digestion of everything that you absorb via your mind and your senses, right? Any sounds, any music, any temperatures, the touch, the temperature works with your sense of touch. Anything that you perceive needs to be digested, right? And if your Agni is not strong enough, then all of a sudden you experience stress. You have these emotional fluctuations. You go maybe to anxiety, maybe you go to anger. Then there might be a lack of understanding. You just, it's like your stomach too full, your brain is too full, and you can't digest what you are presented with. Right? One thing I'm very animate about is really in these days and nowadays is really sensory overload. If people are 24 hours on their phone, whether it's flickering movies, whether it's sounds, that's very intense for your brain, and that needs to be digested. So keep that in mind, that once when you brain fried after 10 hours of Zoom or something, that is basically sensory overload, right? It's just too much of something. So keep that in mind. even sensory impressions, even mental things need to be digested properly in order to work, right? So manage your sensory inputs, manage your Zoom hours as much as you can, conditions permitting. Vatas benefit from more silence, more rest, because they're a bit more fragile to start with. Pittas need to calm and cool. So that last YouTube movie at 12 o'clock midnight, not a good idea, just a little too much. And then Kapha actually needs more stimulation, right? Because it needs the movement, both physically as well as mentally. Right. All right. Any questions at this point? Nope. All right. So I was mentioning a few times the tissues. And in Ayurveda, we look at 7 tissues, types of tissues. These are not biological tissues. These are types of tissues that we look at. 7 of them, Rasa, Rakta, Mamsa, Meda, and Asti, Macha, and Shukra. The reason why I mentioned them here is that actually in Ayurveda, we think of them kind of in a hierarchy. Right? So when you eat something, the first tissue that gets nourished and where the food and the nutrients will be absorbed is in your blood plasma, right? Then the red blood cells are nourished. Then the red blood cells will nourish the muscle tissue. And then afterwards, basically the fat tissues will be absorbing whatever is not needed from the muscles and so on. So if you think about it, if I cut my finger, then it bleeds a tiny little bit. You have definitely the rakta, the red blood cells involved, because you see the blood. And that would heal probably in what? Latest a week or so, right? If it's a small cut. However, if you break a bone, then all of a sudden we look at 4, 5, 6 weeks, right? Depending on the size of the bone and on the fracture. So that tissue hierarchy is a little bit of an explanation about why certain tissues take longer to be nourished or to heal once they are broken, or once they're broken. Because the nutrients basically have to pass through each of the layers in order to get there. Right? So that's why certain diseases, let's say you have Alzheimer, or you have what's the other one? Parkinson is the one. So that's obviously a disease in the matcha, in the nerve system, which is the matcha dhatu. So that will take a little bit longer to build up again, or to basically remedy than, for example, just a cut in your finger, which is much easier because it's basically Rasa and Rakta mostly. Does that make sense? So just to give you an idea. The last tissue, which is really not a tissue, but a very important concept in Ayurveda, is ojas. And the ojas is what we call the essence of kapha. Ojas is a fluid, if you want, right? Because it's kapha-ish. It's really a fluid in your body. That's the way Ayurveda imagines it. But it gives you immunity, and it gives you a certain glow and energy, right? It's really your life immunity, right? So imagine the glow that certain pregnant women or little babies have, right? They have this glow in their face, and that glow is strong ojas, right? It's just that immunity, that radiance that comes with a healthy and balanced ojas, right? It's said to reside in the heart, but it can only, remember that tissue hierarchy, it all starts with digestion. And if your digestion is compromised, then you will not be able to build up that ojas, right? So that's again why digestion is so important. But then when you have healthy tissues all along, then you actually can build up that life energy, that contentment, that glow that comes with a really balanced health. It is easily and negatively impacted by, for example, trauma, either past or present, by major changes, major uprootings in your life. You know, like you move, you change jobs, you lose somebody dear to your heart. But as well for sensitive people, it might be even a change between seasons. Age, with age, we all our tissues break down. So even that brings down your ojas And that's where people in older age are more fragile and more susceptible to infections and things. So it's really something that you want to watch and you want to build up as best as you can through healthy lifestyle, diet, and so on. How you can do that is really eating good food, fresh food, wholesome food, eating regular meals, sticking to your daily self-care routines, whether it's yoga, abhyanga, which is a self-massage, or exercise, just sticking to those, making sure that your tissues can absorb the nutritions. Being in nature, going for a hike is wonderful because it really builds ojas right there if you are in nature, or go to the beach. Get enough sleep. You all heard about it, but many of us skip it anyway. And then the other thing that builds ojas is really do the things that you love, whether it's creative work, whether it's playing the piano, cooking. So really, if you do the things that you truly love, then actually that builds oja because you are in your zone, you are in your happy space. Okay.
Dr. Rock, I think we have a question in the chat.
Sure.
Does ojas also correlate to longevity? For example, in Chinese medicine, they have Jing.
Yeah, that is correct. The more ojas you have, the longer you will be healthy and energetic, and that is correlated with. It's not the same thing, but it's correlated with longevity. Absolutely correct. So how do we treat people? So let's assume somebody comes to me with migraines or constipation or diabetes or something. What do we do? So first thing, we look at the individual, right? I determine the base constitution, but I determine as well what the current imbalances are, right? There is no one formula for diabetes or for, I don't know what, ulcers or something. It really depends on the person. What really works for them. We have certain herbs that are cooling, but nervine sedatives. For example, if somebody can't sleep, right? Then they could be, I have nervine sedatives that are cooling, which would be the ones that I use for pitta. But then I have nervine sedatives that are actually heating or more warming. And those are the ones that I use for vata and kapha people, right? So I really have to understand that individual person in front of me. And then I have to pick the right treatment for them. Do I need to get them moving, whether with spices or with physical exercise or with, changes of something, or do I have to cool them down? Do I have to calm them down? So it's very individualistic, and really nothing is good for everybody. So if you hear things, smoothies are great for everybody, or turmeric is great for everybody, just skip it. There is not the one thing that's good for everybody. It really all depends on where I am in this particular moment. Okay. And then I look at the disease or, whatever the issue is. And then I look at the qualities of that issue. Is it inflammation? So that's there is too much pitta. Is it a lack of movement? So for example, they have a sluggish digestion, right? And I need to basically increase the heat and the movement here. So I look at the person and I look at the issue, and then I basically find the treatment that balances those out. Does that make sense? So it's really not one size fits all. Not everybody gets turmeric, not everybody gets smoothies, So I need to match that to the person, to the imbalances, and then to the disease. So then the treatment is really tailored for that particular individual. Here's a few examples. For example, a productive cough would have kapha elements, right? It's mucousy, it's slimy, it's whitish. So that I would consider that basically a kapha imbalance or a kapha issue. A dry cough, because it's dry, would be more a vata cough, right? So that's how I look at every issue or every imbalance or disease. I really qualify it with those descriptive qualities that we talked about earlier. So diagnostics in Ayurveda are done through several things. So the pulse is very interesting because the way, it's not just the rate of your pulse, that's just one element, but it's really as well the quality of your pulse, right? Is it round? Is it spiky? Is it sharp? So these kind of things can be observed, and we do that in Ayurveda. I believe the Chinese do it too. They do pulse readings, so that's definitely an art, but it's definitely very, very interesting and very informative. I mentioned the tongue already, that we look at the coating, at the teeth marks or scallops. We look for cracks or for depressions, you know, are there certain areas that are more depressed than others? Because the tongue basically, same as in foot reflexology, certain areas of the tongue correspond to certain organs and parts in your body. So this person here, for example, you see there is a bit of a whitish coating in the back, and it's definitely kind of a dry tongue. And I see a bit of a depression in the tongue on the tip, if you can see that. Right? So that's the things I would look for. Then the physical and emotional traits. That's basically the stuff that you see on the dosha questionnaire that you saw a few slides earlier. I look at type of eliminations, whether there is any odors, size from the mouth or size from the be it from the sweat. And then, of course, as I mentioned earlier, I look at disease symptoms. And here are the classical, or the most important Ayurvedic therapies that we look at. Food is probably the most influential treatment, if you want, or input that we give in our body. We do it every day. And every food has certain qualities. So it's certainly one of the most important input factors that we look at. As I mentioned earlier, nothing is good for everybody. Everything is good for somebody, but not for everybody. Raw foods are harder to digest. You need more digestive fire than cooked foods. That's, you know, that's the reason why humanity cooked for the last, I don't know what, 10,000 years, because it's simply easier to digest. And all of you probably got, when you were, let's say you had a fever when you were a child, none of you probably got a salad. You always would get chicken soup or, you know, some soup. Because when you're sick, your digestion goes down. And that means that you want to have something that's easy to digest. So depending on your strength of digestion, you want to eat something that you can handle, right? 3 meals a day is the best for normal, you know, as a prerequisite, simply because that allows your blood sugar to be fairly balanced throughout the day. And it allows basically for you to have enough energy throughout the day to get your job done. The American way of having a heavy dinner and a very light lunch doesn't really make sense, because you still have to work the day. And then by 8 o'clock at night, you don't really need those calories anymore, because you're basically gonna be on the couch for the rest of the day, right? So it's best basically to have 3 meals, and a medium breakfast. The biggest meal should be lunch, and then a light dinner. That would be ideal in terms of calorie usage, right? If you think of when you use your calories. And actually your digestion goes up and down with the sun. So at lunch, you have the strongest digestion. So if you want to have that cheese pizza, then have it at lunch, you know, because that's when your digestion is the strongest. Like, if you have it at 10 o'clock at night, it's probably going to stay with you for a while, right? Because your digestion is not as strong as 10 o'clock at night than it is at lunchtime. Okay. And then here's just some examples. Foods, obviously, like anything else, has qualities that we look at. Lemons are sour, so they are heating. Pepper, chilies, obviously, and ginger are spicy hot, so they would increase pitta. Oats are moist, heavy, and cooling, so they are great for pittas and vatas, but not so great for kappas. Cheese is heavy, moist, and cold, so it kind of kills your digestion, which means pittas do well on it. But if you already have a kapha digestion, then you probably should limit it, because it's probably just a bit too much. Okay. One thing I want to mention, I'm not gonna, is really CCF, cumin, coriander, and fennel. Super easy to get. You can get it anywhere, and it's a really wonderful digestive tea. So if you ever had this pizza at 10 o'clock at night and you really feel full and sluggish, have a CCF tea. If you want, you can add a little bit of ginger if you're not too spicy hot. It's amazing how well it really will help your digestion, and you will feel better within 20 minutes. It's really very, very simple, but very effective, right? My other pet peeve is actually drinking too much water with meals. If you fill up your stomach with water, either right before the meal or right after the meal, then your stomach is just too full and you can't digest the food properly. So around meal times, reduce your water intake and make sure that basically your stomach is filled with the food, but not with excess gallons of water, right? It's just not good. You're just basically putting water on a campfire, right? You're just killing the fire. Here's a khichdi recipe. That's a super easy recipe for a type of a bean rice soup. Super easy to make. Takes 10 minutes in the pressure cooker. Easy to digest. So if you really maybe have a fever or feel a little bit sluggish or tired or something, it's the most famous Ayurvedic recipe there is, I think. I'll let you read it by yourself. We talked about the herbs. So we look at the disease qualities, we look at the individual constitution, both the base constitution as well as the imbalances. And then I match the herbs with it that works for that particular situation. Yoga, and I guess you're all familiar with yoga. Again, nothing is good for everybody, right? So my favorite pet peeve is, for example, if you are high pitta, which means you have a lot of heat and a lot of already in your head, headstands are, it's the royal discipline of yoga. I totally understand. They are not ideal for pittas, right? Because you just increase the heat in the head tremendously. So grounding, seated positions, cooling positions are much better for pittas. Whereas for kappas, for example, headstands are great. Right? So like with everything, nothing is good for everybody and everything is good for somebody. That applies for yoga the same way. That applies for breathing techniques like pranayama. So you really have to tailor whatever you do, even in yoga, to your well-being. And just go by your feeling. If you don't feel comfortable with a headstand, then just don't do it. Go by your body. Your body will tell you whether you feel more comfortable, more energized, or actually depleted. Depending on the asana. And then Panchakarma is the jewel treatment or royal discipline of Ayurveda. That's a very in-depth detox treatment, right? So let's say in my age, right, I'm 54, over the years, I have accumulated crap. I ate my pizza, I had my tequilas or whatever else, and probably all of that is still residing somewhere in my body. So, or in an extreme case, or in a more dramatic case, you just came out of a chemotherapy, right? So you want to get rid of all these toxins that are maybe lodged in my elbows or in my knees or wherever my arthritis is. So then Panchakarma would be the right thing. Pancha means 5, karma means action, so it's 5 actions. And it really removes deep-seated toxins and excess doshas from your body. And they do it by steam baths, oil massages, specific diets that are tailored to your specific situations. They like to do bastis, which is basically enemas in your colon. And depending on the issues that you have, it might take anywhere from 2 weeks to 3 months, right? So it really is depending on what you have and what are diseases that you want to treat. Right? Panchakarma centers are available in the US, but as well, obviously, many of them are available in India for about half the price. Right? So just if you want to do it, and you want to combine it with adventure travel, then I would definitely recommend going to India. And then we have, I think that's the last slide, we have mama therapy, which is very similar to acupressure in the Chinese medicine. We have certain energy nadis or knots or, centers, nerve centers. And if you massage them and you activate them, then you can balance out both doshas or imbalances accordingly. Right? So it's very similar to acupressure, working with the acupuncture points, and we have something very similar in Ayurveda, and they call that mama therapy, mama being that acupressure point. And you can use it with Panchakarma, but you can use it independently as well. For headaches, you can just basically press certain nerve points here. So it doesn't have to be a full panchakarma. And I think that's it. That's all I have. I talk very fast. I apologize for that. So, but maybe you still got some ideas or any questions. I can move the slides back and forth.
Thank you so much, Dr. Rock. It was so interesting to listen to you for the second time. This is my second time. So thank you so much. But yeah, we are open for questions. If you guys have any questions or any comments, we still have time.
There is a little 3 under the more thing. Is that something I need to watch? Is there a question?
Yeah, in the chat. So it says, do you also use the meridian theory for marma therapy?
Yeah, we call them nadis. The Chinese medicine called them meridians. It's very similar. We have 117, and I think they have 135 or something points on those meridians. But yes, it's a very similar technique. If I click on the 3, let me see. Here. Is there a website that you recommend us to use to find our own constitutions? So you can use the dosha questionnaire that you see in the slides, but there is Banyan Botanicals, and you see the web link in the appendix. They have a dosha questionnaire there. There is another site called Joyful Belly. They have actually tons of really nice recipes. They have a dosha questionnaire, but I'm sure if you put in dosha questionnaire on Google, I'm sure there is probably a dozen more for these dosha questionnaires. Look for dosha quiz or dosha questionnaire. That's usually where they come up.
I think Marie, you had your hand raised.
Yeah, I was just wondering, like how did you, I guess, learn about Ayurveda, or like what was your path, or like how do you learn and stuff like that?
Sure, happy to talk about it. So I got in it by curiosity, let me put it that way. So I went to India. I went to a massage place in the middle of the boonies somewhere, quite interesting. And then when I came back, I had an introduction in a yoga studio, and they basically said introduction to Ayurveda, similar to what you listen to today. And then they said, well, here's the questionnaire. So I did my questionnaire, and then I was horribly confused because obviously, you know, I had all these signs, and then it was pretty much everything. And then the teacher basically said, if you want to know more specifically from an expert, then you have to go see that lady practitioner. So I went to see her out of curiosity because you know, with the pulse, the tongue, and all the other things we do as practitioners, we do a little bit more than just a questionnaire. So I went to see her, and ever since then, I was basically hooked because it just made sense to me. You know, the philosophy, the logic behind it. Being a good old Pitta, I like logic and structures, mental structures. So it just made sense, and that's basically. So I saw this practitioner maybe for I don't know what, maybe 5 years. And then eventually I decided to actually go to the Ayurveda college in Grass Valley. And I first studied part-time on the side of my job, and then eventually full-time. And now I'm doing it full-time, Ayurveda. So it's really, I would recommend maybe go see a practitioner simply because it's really so much more they can tell you and how to approach you individually. But there is tons of books. I mentioned a few in the appendix as well. There is one that I like for beginners very much, which is called, hold on. Can you see that one? It's probably, right? It's from Dr. Lat. He has a ton of books, but that one, it's called The Science of Self-Healing. I think it's a really great introduction. I mentioned it as well in the appendix. So if you want to start reading, there is really a lot of stuff out there on the web, but then that book I really like for starters. And then if you are interested more, then I would really recommend go see a practitioner. You don't have to be sick to see a practitioner, right? Because it's all about staying healthy. It's not just only for sick people. It's all about learning yourself and learning how to sail your boat. But that's pretty much what it is.
Great. Thank you very much. Thank you for sharing.
Absolutely.
Anybody else has any questions?
My contacts are as well in the back, as well as my website. There's a few resources there as well. I think I have a few blog posts out there, all something around Ayurveda. So if you want to look up those.
Yeah, it's the PowerPoint is going to be shared on the B courses, so you all will have access to it. I think it already is posted. So
let me see what I have. Abhyanga, you can try. My favorite self-care tool is daily oil massage. I would definitely recommend you to try it. It's lovely. I use a little rose oil. It's just my daily spa thing, so it's great. But I wanted, here are the references, just so you see a number of books there that I can definitely recommend. There's a question. Where do I get my oils? So that's a very good question. So for treatments, actually, I cook them myself, right? Because what we do is medicated oils. And you cook the herbs first in water to get the water soluble stuff out of them. And then you add the oil, and that way you get the oil soluble ingredients and stuff out of them. And that gives you a medicated oil. So again, I cook these oils for my patients depending on their individual needs, right? And that could be an oil, that could be a salve, doesn't matter. It's all the same process. So that's what I do for treatments. You know, if somebody has arthritis or somebody has a broken bone or something, I would use these cooked medicated oils with particular herbs cooked in them. For my regular, you know, my daily oil massage or something, I use a brand called, I get some of them from Banyan Botanicals, and I think I have the link, yep, on the resources. And then my favorite rose oil is actually from Weleda. It's Weleda. They have a wonderful rose oil. They have it at Whole Foods, I think. So it's a German brand. I'm German, so you know a little bit of home stuff. But it's really a very natural. There is nothing artificial in there. You could actually eat it. So that's a really nice rose oil that I like. But Banyan has really nice oils. That I like as well. In general, you should never put anything on your skin that you wouldn't eat, right? So because your skin, you know, everything gets in the bloodstream, and then everything basically has to be digested by your liver. So if you want to be good to yourself, then use a sunflower oil or a sesame oil or, you know, some food grade oil for your daily oil massage or even for your facial care. So I use your jojoba oil for my face. There is nothing else in there. It's just anything needs to be digested. If there's chemical stuff in there, will end up in your liver, you know. So just a word of, if you stay as natural as you can.
So I'm just going to announce the reflection code for today. So it's dosha, it's a DOSHAS that we really talked about today. Thank you, Dr. Rock. I think we do have some questions popping up.
It's just a comment.
So are there natural SPF?
Yeah, I do. I actually make a sunscreen. Zinc oxide is a wonderful one, and I cook it. Basically, I mix it with oils. But then there's a few others. Raspberry seed oil has a lot of SPF. So, but yeah, these natural sunscreens that I make myself or that I sell as well, they are simply not as strong, right? So you need to apply them a bit more. more often. There are some recipes out there on the web to make your own. Carrot seed oil has a few. The main ingredient in my sunscreen is zinc. That is really helpful. But yeah, you need to apply them a bit more often than the regular ones. Elle has a question, how long does the cooking take? That depends on how much you actually cook. So if I do, let's say, a 3 ounce oil, probably an hour and a half, something like that. The bigger the quantity, the longer it takes. The smaller the quantity, the less time it takes. Right. So what you do basically, you cook first the herbs in the water, you wait until the water is reduced by half, and then you basically add the oil and wait until the other half of the water is cooked out, evaporated. Okay, so that's what takes the time.
Okay, I'm gonna stop the recording, but I'm gonna announce the reflection code again. It's DOSHAS, DOSHAS. So please turn in your reflection forms by Wednesday, 11:59 p.m. And thank you so much, Dr. Rock,
My pleasure.
for coming in. It was so interesting.
All right.